Hello friends, welcome again to your own YouTube channel Ask Your Gynecologist. I am Dr. Sonal Parihar. As usual, I have come back with a new video and the most wanted video of these days, that is about contraceptive pill, that is emergency pill, also known as I pill or unwanted pill. Now, there have been many requests from the patients, from the viewers, that we need to know about I pill, the safety of the I pill, and how long we can use it, how to use it, what are the other methods. So I just thought I should make a small video on the safety of this pill and who all can use it, who are the best candidates to use it. Although I have already made one video initially, right about say about 8 to 10 months back when I started the channel, there was a video on I pill. That was a very short video, I think 1.5 minutes. So I thought maybe you need a more detailed video, so that is the reason why I have come back with the same topic. Now, before I start with the topic, let me just thank you all for the tremendous response you've given to the channel. It has grown very well. Thank you for watching my videos, for subscribing and for sharing. Thank you very much. Now, to connect with me directly, if you want any consultation, online consultation, then you have to download DocWise app on your mobile's Play Store, and then you have to insert my pin, because there are many other doctors on this particular app. So if you insert the pin C2TXJ, you will be directly connected with me, and then you can chat with me just like WhatsApp. You can send your reports to me, you can send voice messages, I can send you voice messages, you can put a call request, and then I can call you. But I can call you only if you are sitting inside India. I cannot call you on international numbers because this application does not allow that, right? So it is a very good way to get prescription and to have an online consultation. Apart from this, I go live every day, you know that, on this particular channel, and in the live session I answer the questions which were normally asked a day or 2 days before, right? So it is very difficult to do live chatting because there are so many people asking so many questions. So I always select your questions from a day or 2 days back, and I select the questions which are more general, which are more informative and more useful for people, the other people who are watching it. I do not answer your personal questions because they are very personal. If you want personal consultation, it has to be DocWise app. Otherwise, there is a option available which is given by YouTube for the people who are watching the live session. There is a super chat option. If you just click on it, YouTube will tell you how much money you have to deposit. It starts with a minimum of Indian rupees 40. So you start with 40 rupees, you type your question, and then the YouTube tells you that the question is too big, and then you keep on adding money, right? So it is a very good way to get a direct answer from me about your personal question, and you can get your answer there and then. You don't need to wait for the next session. Okay, so these are the two ways to connect with me. Apart from this, some people ask me for my personal phone number, which I cannot give. I always give you my secretary's number. So this is my secretary's number. You can call her and take an appointment with me. The hospital address is there if you want to come and visit me there. And then there is another option which is Paytm. This is the other number. Please do not call on this number. Please just Paytm if you want to connect with me. You can Paytm here and WhatsApp your question on this particular phone number. Then you can get your answer on the live session, right? But it has to be a personal question. General questions I am already answering. Okay, so let me come back to the topic. Emergency contraceptive pill. Now, what does it do? Emergency contraceptive pill, it comes in the form of either 2 or single tablet. It is a high dose progesterone. It contains 150 milligrams of progesterone, which is very much equal to the DMPA, the depot medroxyprogesterone acetate, which we have discussed in a video of contraceptive devices. Now, it is a high dose progesterone which can be given in an injectable way, that is the depot form that I just told you. Now, it is valid for 3 months, the one which I told you, that is a depot form, IM. This particular dose has been prescribed to patients, to people who have unprotected intercourse, and it has to be taken within 72 hours. That is within 3 days. Now, it depends when you are taking the pill, it depends when you had the intercourse, that defines its safety. Right? So the failure rate will be more if you delay taking the tablet more than 3 days after the intercourse. The sooner you take it, the lesser the failure rate. The best is to take it immediately after unprotected intercourse, or if you take it within 24 hours, then the failure rate definitely reduces to 95%. So if we talk about the failure rate grossly, it is around 97% successful, that is only 3% failure is there. So if you take this pill within 3 days, within 72 hours, only 3 out of 100 patients will get pregnant. So there is a failure rate. It is not foolproof. Nothing in the world is foolproof. Whether it's ligation, whether it's copper T, whether it's IUCD, whether it's a 21 days pills, anything, injectables, everything has some kind of failure rate. Similarly, the emergency pill also has a 3% failure rate. But as I said, if we take it immediately or within 24 hours, the failure rate reduces to 2%. From 3% it comes to 2%. Okay. Now, what are the side effects? Side effects are very much like taking any kind of high dose hormone. It is very much like PMS, premenstrual syndrome. Nausea, headaches, giddiness, some problem in the tummy, some sort of gastritis, pain, crampy pain. You might have diarrhea. Some people have diarrhea. Then you might have irregular bleeding. Sometimes when you take this eye pill, you suddenly start bleeding, and that sometimes scares you and you feel, oh my god, what has happened? Well, this happens because it is a very high dose hormone. It disrupts your internal hormonal cycle, and because of that disruption you get irregular periods. That is why we advise you not to take these eye pills every day or every now and then. Please don't take it just like a normal contraceptive thing, right? It is not a normal contraceptive. It has been given the name of emergency pill. Emergencies do not happen so often. Okay, emergencies happen probably in a status where you are unmarried, or probably when there is a condom failure, the condom bursts. These are certain emergencies which happen probably once in 6 months. They do not happen 3-4 times in a month. I have seen patients who actually take eye pill just like a normal contraceptive pill. They are married and they're taking it after every intercourse, which is not good. It is going to absolutely disrupt your menstrual cycle, and you tend to have a lot of cramps, you tend to have a lot of bleeding in between periods, irregular periods, and then it is very difficult to control. Some ladies will even have some sort of breast tenderness. Now that is again a part of high dose hormone. So high dose hormone gives you all the symptoms which mimic the symptoms of premenstrual syndrome, that is PMS. Now what if you vomit after taking the tablet? Because it is a high dose tablet, sometimes you vomit within 1 hour. So if you vomit within 1 hour, then it has to be taken again. But if you do not vomit within 1 hour, it was later, then it doesn't matter, because by that time the tablet has already been dissolved inside your stomach and it is already started acting. Now, what happens if you are not able to take the tablet within 72 hours? That means 3 days have passed and you suddenly realize, oh my god, what did I do? Now I really need some contraceptive, some emergency contraception so that I do not get pregnant. So you still have some option left. Within 5 days, if you are not able to take the tablet, within 5 days you can go to a doctor and get yourself a copper T, an IUCD inserted. Now IUCD normally is inserted in ladies who are already parous, who have already given birth to a child or at least had one abortion. It is very difficult to insert an IUCD in a nulliparous or an unmarried woman who has never conceived or never aborted or never delivered a child. But then this is an option for married ladies. Sometimes they do consult me. That is why I'm telling you that if you in case miss the tablet or you're not able, the tablet is not accessible, then within 5 days you have to go to the doctor and get an IUCD inserted. Apart from this, there is no other option. In case 5 days have passed or you do not have access to the tablet or the copper T, then you just have to wait for your periods. As I said, it has 3% failure. In case you conceive, then you have to go for an abortion, and for abortion you cannot do online consultation. This is for patients who unnecessarily want me or other doctors to prescribe medicines online, or they try to buy these medicines from Amazon or I don't know where. Please don't do that. The laws are very strict. You just have to go to the doctor, sign the form, sign the consent form, provide your ID proof, your identity, your photo identity, and then you get the pills. Okay, so that's it guys, that's all for today. I don't think you need to know more about eye pill. Just be safe and do not just take medicines on the counter. Always consult a doctor and do not be very experimental with your body. Okay, right? So take care. Bye bye. Thank you for liking my videos. Thank you very much.